with one click of the mouse we just start the scanner.
Non-lethal view of lower left 5.
Okay. Rightio, so it's asking us for the lower view of the lower second premolar.
Lingual view of lower left 5. Buccal 45 degrees view of lower left 5.
What's this asking you to do, Nick?
It's just asking me to move from tooth to tooth.
Mesial contact of lower left 5. Segment finished. Lower left buccal. Buccal 45 degrees view of lower left 7. Buccal 45 degrees view of lower left 6. Buccal 45 degrees view of lower left 4. Segment finished. Lower left lingual. Lingual view of lower left 7.
So you're doing the lowers now?
Yeah, doing the lowers now.
Why is that? Why do you have to do the lower if you're doing?
Lingual view of lower left 6.
It's totally customizable, so if you wanted to, you could change that.
Lingual view of lower left
Just
4.
been the way it's been set up.
Segment finished. Upper left buccal.
Okay, so move
Buccal
to the upper.
45 degrees view of upper left 7.
Bit of a stretch here. Last time I did this, I discovered on your 8.
Buccal 45 degrees view of upper left 6.
Poor Jen's been scanned a few times.
Buccal 45 degrees view of upper left 5. Buccal 45 degrees view of upper left 4. Segment finished. Upper left genital. Genital view of upper left 7.
Why is the wand flashing?
It's got like a rangefinder in it, so it needs to be within, I think it's 15 to 18 millimeters
Please retake scan.
before it will focus.
Genital
So
view of upper left 4.
that helps it work out whether it's focused.
Segment finished.
Okay,
Left 5.
right here. Close together. Bite together.
What are you doing now?
It's just taking a digital bite record.
Scanning finished.
So that's it done. So if we sit Jen up, the computer's going to use an algorithm to smooth out, remove things like my finger, or if there's a little bit of cheek involved, and then it will make us a virtual cast that we will then be able to show you. So how was that, Jen, compared to the conventional one?
Fine, a little bit dry, as you know, with the air, but other than that, it's completely comfortable.
And that's our
that's upper and lower done in one shot.
And that's our experience, is that patients appreciate this because of the fact that it's only the area of interest. It's patients in the past, a lot of patients have been put off having impressions because of the full mouth nature of the impressions. It is possible to take a full mouth with this, of course, but the great advantage is that if at some stage if the patient was to feel slightly claustrophobic or panicky, then we can take the wand out, sit them up, let them have a few minutes. If they need, they could get up and have a walk around, compose themselves, come back, and we can then continue on with the impression. I call it actually making rather than taking, because in the conventional system we take the impression, one shot, if it's right, it's right, if it's not, it goes in the bin and you start again, which can generate massive extra time. With this, if for some reason we need to stop or we have something that we're not 100% happy with, we can then just delete that scan and just rescan it. Okay.
Could you tell us perhaps a little bit about the impressions that you've got there and what happens to it from now on?
Okay, so the computer has finished developing what we would call a virtual model. We have a legend here which allows us to have a look at this colouring, and what that's doing is, if I click it on, click it off, the red areas are where there's less than 1.10 of room. Now this is important when you're preparing crowns or restorations that need certain amounts of clearance. So if you needed a clearance of greater than 2, then you have to have the blue colour where showing on your preparation. If you have the red colour, then you're too close. And this is a great thing because it allows for the dentist to visualise the work before it goes off. If he needs to adjust it, as I said, you can just add to the impression or modify the impression. It doesn't mean starting again, and therefore the workflow between dentist and technician is so much improved because you've provided the space for them to make the right restoration. If I get rid of this for you now and we bring in the upper teeth, then you can see how the digital bite has approximated the upper and lower teeth together, and this is one of iTero's, or Cadent iTero's things, the perfect bite, B-Y-T-E. So a sort of take on the computer side of things, and we've done hundreds of cases now, and the bite is truly phenomenal. Certainly an illustration of how accurate the system is. And when we first got the system, we checked this very intensively because we couldn't believe that just by taking a video scan of teeth and then putting them together we'd be able to get this level of accuracy, and that's one of the reasons we're now using this technology primarily for our implant work as well.